Welcome to my final video submission for Assessment Task 1. Today I'm going to be discussing the perioperative nurse's role in managing a patient in a post-operative care unit, the PACU, specifically in managing the safety issue of airway, breathing and circulation in a post-operative patient in a context of providing quality and safe patient-centered care. When a post-operative patient arrives to the PACU, the anaesthetist and nurse provide a handover to the PACU nurse as described by Hamlin et al. 2016. The handover should be given and received following National Safety and Quality Health Service National Standards recommendations, referring to clinical handover, in that whenever accountability and responsibility for a patient's care is transferred, effective teamwork and communication must be a priority to ensure high-quality clinical decision-making. Hamlin et al. 2016 explained that patients in the PACU are at known risk of clinical deterioration due to the depressant effects on the body systems by anaesthesia. The respiratory and cardiovascular systems are particularly vulnerable, and therefore post-anaesthesia patients must be closely observed to anticipate and prevent any complications. Australian College of Operating Room Nurses 2016, ACORN, suggests that the role of the PACU nurse includes recognising and responding to clinical deterioration by using critical thinking and collecting and interpreting data to implement and evaluate quality and safe nursing care to minimise the incidence of post-anaesthesia complications. Akhtar, McFarlane and Wasim, 2013, discuss how upon receiving the patient in the PACU, the initial patient assessment is performed by the nurse. The initial assessment follows the ABCD approach, where airway, breathing, circulation and disability are examined. Hamlin et al. 2016 discuss that anaesthetic drugs are the main cause of airway obstruction in the PACU, and therefore ensuring airway patency is critical. If an obstruction has occurred, immediate action is required to maintain the airway by identifying and removing the cause. Common causes of airway obstruction include the tongue falling backwards, the presence of secretions, laryngospasm and laryngeal edema. Other respiratory complications that can occur include atelectasis, aspiration and bronchospasm. Nursing interventions suggested by Akhtar et al. 2013 to prevent these complications include positioning the patient optimally and the removal of excessive secretions. Assessment of the airway and breathing is a priority in the initial patient assessment as well as throughout the patient's stay. The nurse should use a systematic approach following a look, listen and feel approach, and any unfitting findings should be immediately acted upon. As a priority, if it is apparent that the patient is unable to maintain a patent airway, the PACU nurse must remain with the patient to provide airway support. The side effects of anaesthesia and surgery are powerful stimulators of the stress response, which can dramatically affect the patient's circulation. Hamlin et al. 2016 discussed that the PACU nurse should conduct a comprehensive circulatory assessment, including heart rate, blood pressure, level of consciousness, and perfusion of skin and peripheries. ACORN 2016 proposed that once the initial assessment is completed and initial patient care priorities are met, a more thorough assessment can be done using a head-to-toe approach. Regular observations will continue throughout the patient's stay until hemodynamic status is determined. Accurate and timely documentation of the condition of the patients is vital in order to monitor progress, ensure early detection of complications, assess readiness for discharge from the PACU, and facilitate continuation of quality care on discharge.